Demand for aflatoxin-safe maize in Kenya. Dynamic response to price and advertising. Presented by Vivian Hoffmann of IFPRI. This is joint work with Christine Moser at Western Michigan University and Tim Herman at Texas A&M, and is supported by the CGIAR Research Program on Agriculture for Nutrition and Health and USAID. Food in low and middle income countries is increasingly processed and distributed at scale. For example, 59% of maize purchased in urban and peri-urban Kenya is processed, packaged, and branded by formal sector millers. This implies traceability, which makes food safety monitoring easier for regulators and also means that firms can potentially use food safety claims to market their products. However, very few firms are currently doing so, which begs the question, is consumer demand sufficient to lead firms to invest in private food safety certification? Previous studies of consumers' willingness to pay for food safety in such settings are often based on hypothetical responses or elicit demand immediately after drawing consumers' attention to food safety. Both of these methods may exaggerate demand. In this study, we attempt to overcome hypothetical and salience biases by tracking the sale of a food safety labeled product over time. We do so in Kenya, where contamination with aflatoxin, a carcinogenic fungal byproduct that often arises due to marginal growing conditions and poor post-harvest practices, is both common and well known by consumers due to extensive media attention. Previous work in Kenya has shown a negative relationship between aflatoxin contamination and price, indicating that maize processors who invest are capable of compliance. In this study, we wanted to test whether a company targeting a lower price point could compete based on food safety. We worked with Osho grain millers and Apteka, aflatoxin proficiency, testing, and control in Africa, to develop a rigorous testing protocol and obtained regulatory approval to label Osho's main brand, 2PK, with a logo indicating that it was subject to Apteka's verification system. We then tracked maize flour sales in 73 shops across eastern Kenya during randomized intermittent promotion of the Apteka labeled flour. The randomized intervention included 4 treatment groups. In one, study personnel distributed flyers to consumers promoting the flour for a single week. In a second treatment, a limited time discount was added to these marketing efforts. In the last 2 treatments, marketing, alone or with a discount, was repeated for 3 weeks over the span of 3 months. We also included a pure control group where no marketing was done. The timing of marketing efforts was randomized across shops within each treatment group, so that we can control for both shop and week when estimating the effect of the promotions. Data collected over a period of 25 weeks before the intervention started show that sales of the target brand 2PK were about 1/6 of total maize flour sales on average, and that this flour was sold at a price that was 7% lower than other brands, but 17% higher than the price of informally marketed flour. Once the marketing intervention started, sales of the target brand increased. The red arrows in this diagram indicate weeks when marketing was active. Blue diamonds show logarithm of sales in the marketing-only treatment group. Sales for these shops were higher only during active marketing and only during the first 2 marketing rounds. By the 3rd week of marketing, we do not see a significant effect of marketing alone. The red diamonds show sales in the marketing plus discount group. Sales were much higher, of course, when the discount was offered, but more interestingly, sales remained elevated after active marketing ceased in these shops. This seems to imply some long-term effect of a more intensive marketing effort. Due to complaints from shop owners not assigned to the discount group, Osho Millers asked us to discontinue the discount aspect of this treatment by the 3rd round of marketing. The green diamonds, therefore, show sales in shops that received discounts twice and then a 3rd round of marketing alone. In this group, sales remained elevated up to the 6th week after this 3rd round of marketing, But by week 7 to 9, these sales had also come down to the level seen in control shops. A survey of consumers near the study shops was conducted after tracking of maize flour sales ended. This survey showed higher knowledge about the specific health impacts of aflatoxin in treatment shops, especially those for which multiple rounds of marketing were conducted. We also see an impact on consumer awareness of the promoted brand. In our final table, we look at which consumers switched, if only temporarily, to the study brand. We find that most consumers who switched did so from unbranded but pre-milled flour. This is a good sign since unbranded flour tends to be more highly contaminated with aflatoxin than branded flour. To conclude, we find in this study that a strong initial effect of food safety marketing, especially combined with a discount on sales, fades over the course of weeks. This suggests that much of the existing literature likely overstates willingness to pay for safer food in the long run. We noted 2 drawbacks of food safety-based marketing from the firm's perspective. First, it was difficult for Osho grain millers to maintain compliance with the food safety standard. This led to interruptions in the use of Eptika's logo, which the wholesalers Osho sells to complained about. Second, the label drew additional regulatory scrutiny. For these 2 reasons, Osho discontinued its use of the label after the end of this study. We take the results of the study as evidence against the likely success of a purely market-based approach to food safety for a mass market product in countries such as Kenya. It is of course possible that longer-term promotion, perhaps by an independent party, could be more effective at building consumer data. Thank you very much for your attention.